Welcome to the ACT podcast space. Our guest today is Linda Clark, a healthcare leader and educator. This episode brings a rare opportunity to hear from someone with 40 years of executive experience across healthcare systems in the world. In July, Linda Clark arrived in Pristina to deliver a powerful 3-day training in leadership module, part of the healthcare management training program in the country. Linda, welcome, and it's an honor to have you as a guest in our podcast.
Thank you, Linda. I'm really excited about being here and this opportunity and to visit this very vibrant and exciting country.
40 years is a rich and dynamic career. What has kept you inspired and evolving as a healthcare leader across diverse systems and settings?
It sounds a bit cliche, but it's all about the people. The people that in our healthcare sector, we're mission-driven. The doctors, the nurses, the allied health professionals, the administrators are here to care for people, for patients and families, and they do it with passion. That's what's kept me so interested. The organizations and the sector evolve constantly. No 2 days have been the same since I started this career. And today was just a great example because we visited the Sheikh Fatima Children's Hospital here in Pristina, and we got to talk to one of the pediatric surgeons, and it was very obvious in his conversation how passionate he is about the children he cares for. That's what keeps you going.
You have led large health systems through change. What is one pivotal moment that shaped the kind of leader you have become today?
I have a lot of long moments, a lot of long years and lots of moments. But I think one of the things that probably stands out the most is when I moved from the U.S., where I had been in healthcare for about 16, 17 years, and I moved to my first international assignment. And what I learned there is how much we're all the same. We have different customs, different practices, but the people that you meet from all the different parts of the world, they care about their families, they care about their communities, they care about their well-being. And when you understand that context, it's much easier to solve problems, to deal with the same issues. We all deal with the same issues around the world, but we have different approaches with different experiences.
Based on your experience with leading roles, both in the U.S. and in international environments, from private health networks to military to public hospitals, what universal qualities do you believe define an effective healthcare leader?
Building on the last question, I think it's all about the context that you're dealing with. Our healthcare leaders need to be able to listen, to understand the context that you're making decisions in, identify priorities, and then communicate those and execute them. One of the key skills that we need to develop is listening. Active listening is one of the most important skills that a leader can have. I'll share with you an anecdote. I had the privilege in my career meeting President Bill Clinton and also the president of the UAE, Mohammed bin Zayed Al Nahyan. Both of those two leaders, who I admire highly, have amazing listening skills. When you talk to them, you are the only person that they're paying attention to. And I think if we emulate that as leaders, we understand more about the context that our patients, families, and community are dealing with, and then we can make better decisions and engage with our constituents better. So I think we need to develop that skill of active listening.
You are fluent in the language of open heart and mind. Can you share a moment from your international experience where this fluency has really made a difference in bridging cultural gaps?
Yeah, sure. It's a very important skill that we all need to learn. And it's not just in international, it's even within your own organization. There are many cultures within your organization. And so understanding that context and being able to recognize that and bridge it's important. The time that I remember most is my very first meeting in Abu Dhabi. I was in a military hospital. I was opening a new operating room. It should have been a very simple thing, 20 or 30-minute meeting. I was very confident because all 5 participants spoke English. So I was, okay, I can handle this, so we can get this done. 2 hours later, we hadn't resolved any problems. And we were all speaking English. But we had myself, who came from American community hospitals. I had an American colleague who came from a military hospital in the U.S. We had a British contractor. We had a German engineer. And we had an Emirati engineer. And all 5 of us brought very different context and the same language, but we couldn't communicate and resolve problems because we didn't understand where the other person was coming from. So you'll hear that consistently from me. If we can pay attention to context, we can sort out all the problems and work it through.
To go back to the leadership module that you deliver a training for healthcare leaders in Kosovo. And here you also represent the International Hospital Federation. The International Hospital Federation model talks about values, not just ideals, but values as anchors for leadership. How can healthcare leaders today stay grounded in values when they face intense organizational and systemic pressures?
That's a great question. And not only is it one of our key domains in the leadership model, we call it the enabling domain. So we as individuals need to understand our personal, our professional, and our organizational values. Because if you don't understand those, you may be working in the wrong setting, you may be working with the wrong people, you may not be able to solve the problems that you're challenged to solve. So that understanding your core values are critical. Early in my career, Joint Commission, who's one of our accrediting agencies in the world, required hospitals to put up their values, to state their values. So we printed posters and we wrote our values. We put them on the wall so everybody could see them. Right before Joint Commission came, I would do rounds and I would ask the staff, what are our values? And they would read them or they'd memorize them, but we weren't living them. We weren't using them to guide us in making decisions. When you change that context and you start living your values, when we put quality as one of our core values, then every decision you make has to answer the question, is this helping or hurting our quality? When we put patient experience as one of our primary values, our primary goals, our primary focus, then we started having at all of our meetings a patient story to keep us close to our mission and what we're trying to do. So there's many ways you can incorporate it, but you have to be committed to using it to the advantage of yourself and to the organization.
Your leadership module puts a very strong emphasis on leading people through change. What are some of the most common traps that leaders fall into during transitions, and how can they navigate these traps?
This is a core competency that all of us have to develop because our world is changing so dramatically. So many new things have come upon us as healthcare leaders. I think the thing that's critical is communication. It's making sure that we communicate enough to our frontline workers. What happens is when we're going through a major change, a reorganization, we as leaders have lots of meetings about this all the time. We're talking about it. We're dealing with it. We're adjusting it to the point where we think we're tired of talking about it. But we need to remember that our frontline staff, who are the ones that are inheriting this change, they need to understand it, and they need to understand the context, not just telling them what they're doing, but why are we doing it? Because if you don't do that, we have smart, educated professionals, and they will make assumptions about why things are going on, and they might not be the right assumptions, and they might create barriers to you achieving the change that you want. So really communicating to the frontline staff and making sure they understand why the change is going on. And sometimes you don't know why. Sometimes the changes are things you inherit, and being honest with them and telling, I don't know the answer yet, but we'll work on it together and we'll find the answer.
One of the first sessions in your module focuses on emotional intelligence. Why is this the foundation of leadership, and why is it so hard to master in high-stressed environments like hospitals?
Emotional intelligence, according to Harvard Business Review, represents 80% of your success as a leader. You're born with your intelligence, but you can develop your emotional intelligence. It's a skill that we can all practice and learn. And if we do it, it yields all kinds of benefits. It yields personal health benefits. It yields benefits in your home life, and it certainly yields benefits in the organization. And it's simple to learn, difficult to practice. So it's only 4 components. You have to be self-aware. You have to be able to self-manage. You have to be socially aware. And you have to be able to build relationships and manage relationships. All 4 of those components have skills and tools to help you develop those and to assess your own emotional intelligence and to be able to develop that.
A big part of the training also focuses on coaching and empowering others. Why is it important for leaders to become facilitators instead of just fixers?
Fixers is an interesting word because no one person can fix anything in a sustainable way, particularly in organizations that are as complex as healthcare. We have so many unintended consequences. We have so many related issues that you think you fix this problem, and it just may create other problems downstream. So we talk in our course about management and leadership as opposed to just fixers and facilitation. Both are important. Management are the skills that you need to execute, to attain results, to achieve your goals. Leadership are the skills that you need to inspire, to create strategy, to develop the people you work with. Each of us needs those 2 sets of skills. You could call it the fixing skills and the facilitating skills. We need both of them. But what's key, other than knowing those skills, is knowing when to use them. Depending on the scenario, depending on the situation, you may need your management skills more. Depending on the situation, you may need your facilitating or your leadership skills more. So it's recognizing that there's 2 sets of skills, and depending on the situation, you might need to lean on one or the other.
In countries like Kosovo, where healthcare systems are still developing and often are constrained, how can emerging leaders grow into their roles without waiting for the ideal conditions to happen?
This is one of my favorite questions. Every organization is resource constrained. Sometimes in the low and middle income countries and organizations, we focus on the finance constraints. But guess what? In the Americas, in the European and the other developed countries that have high resources, they're still resource constrained for 2 reasons. Healthcare needs are infinite. The more you have, the more opportunities there are. And so you're constantly having to prioritize and balance those resources. And it's not just financial resources, it's time and talent. So being able to prioritize and focus on the key things that are important to your organization will help you get some momentum and be able to manage within those constraints. Innovation is not expensive. Innovation is something everybody can do. And one of the benefits I found with the IHF is we have members from across the world, and many of the best answers come from our low-income organizations. I'll give you an example as the CEO of a maternity hospital. One of the big things that we were focused on is making sure we had the right baby with the right mother, never mixing those babies, transferring the wrong baby. So we had this very elaborate system with bracelets for the mom, bracelets for the baby. Alarms went off, doors were locked. And what we found from one of our colleagues in one of the Asian countries is they had an index card, a piece of paper. The mother signed that piece of paper and put her name on it. They tore it in half. Half of it stayed with the baby, half of it stayed with the mother. When they were making a transition or a transfer, they had to match the card. There was no expense. It was as secure as the other systems. So innovation and thinking about creating new solutions don't have to be dependent on money. So it's being able to get your head around that and focus on your resources that you do have, the energy, the talent, the time that you have, as well as the financial resources.
What is one practice or mindset shift that you would like every healthcare leader in the world to adopt starting from tomorrow?
That's easy. I think it's called management by walking around or rounding. It's proven, there's evidence to prove that it's one of the best management practices. But we get so busy and so tied up with our meetings and our activities and our pressures. So I recommend 2 hours per week, 1 hour if you can't. Block out that time. Every Monday afternoon, every Wednesday morning, block out that time on your calendar and go walk around. Go talk to your employees. Go talk to your patients. Talk to every level of the organization because there's wisdom and there's insight that you can't get from your office. And if you're going to achieve your core value, if you're going to develop your emotional intelligence, if you're going to be successful, having that opportunity to interact on a human basis makes a big difference and a big outcome. At first, the employees will be very shy, and because of your title, because of your position, because they'll be suspicious of what it is you're trying to do, but you have to do it regularly. And once they know you're coming, they'll save those good ideas. They'll share those good opportunities, and you'll develop that trust, and you'll get access to so much information that you won't get any other way.
Thank you so much for sharing your insights, your information, your expertise, and your humanity. Your belief in value-based leadership and the power of cross-cultural connection is inspiring and deeply relevant for our healthcare systems today.
Thank you. I enjoy it and I appreciate it very much. It's an amazing career that we have opportunity to serve in, and there's ways that we can make it less stressful and better for ourselves and our patients and our staff. Thanks.
This was another episode of ACT Podcast. Until next time, stay curious about health topics and keep advocating.